Hi, my name is Bill Hardiman. I'm the state senator from the 29th district, which includes Grand Rapids, Kentwood, Cascade, Lowell, Virginians, and Grattan townships. And I'm very pleased to be here with you today. This is From Capital to Community. And on this program, we'd like to take a look at some of the issues and very important things taking place in our community. Very pleased to have you here today. I'm also very pleased to have some friends here today that are going to help us discuss some issues and discuss a very important program that's taking place right here in our West Michigan community. My guests today are Diana Seeger. She's president of the Grand Valley Community Foundation and a longtime friend. We were just reminiscing a bit about some of those old days. I think we were both working with United Way and talking about programs and that would help our community back then, but I always had a lot of great fun with Diana.
We did.
A newer friend, Kevin Konarska, who's superintendent of the Kent Intermediate School District. Kevin, great to have you with us today, and just a pleasure to talk about this very important program. Today we're going to talk about the Kent School Services Network. Now one might wonder, what is a Kent School Services Network? Well, it's a great program. Kent School Services Network is a cooperative community initiative to provide a wide array of health and human services for children and their families in the schools children attend each day. It's great to have both of you here today.
It's great to be here, Senator.
Absolutely.
Well, let's talk about this network. I gave a brief description of what it is, but can you tell us in your own words what the Kent School Services Network is?
Well, just simply, it's a great partnership. It's a collaborative partnership between the public schools, the human service agencies, the health agencies, and the philanthropic groups in the Grand Rapids area. And when you bring these services together and provide support right inside the schools, I think it creates an opportunity to make special things happen, and that's what we're seeing firsthand.
Well, I have to tell you, I visited obviously the program, the network, and just had a lot of discussion about it. But early on, I visited a program where the Department of Human Services actually, I think it was kind of a pre-runner of this program, actually located a staff person in one of the schools. And I thought, what an incredibly great idea, because now we're taking services to the community and to the people. And what better place than at a school, because obviously the kids go there, the parents we hope will go there to meet with their kids, and now many of them do, so why not have the services there? And now you've combined with many groups to have a whole array of services there. That's great, it really is. When was this created, and how was it organized?
Well, you know, it was started really several years ago, Bill, when they're formerly known as the Grand Rapids Education Reform Initiative was looking at the issues as they relate to quality public education within the city of Grand Rapids and the surrounding area. And at that time, we were looking at something called community schools and looked at the work that had been done throughout the country in regard to that. Now, what you referenced was having a Department of Human Services worker in a school, and frankly there are a number of those types of efforts across the state of Michigan, and they're called Family Resource Centers. But when we looked at a community school, it was probably one of the better ways of saying, what can the community do to really enhance the school experience as well as the family experience within our community? I like to think of it as a humane way of delivering services, a place where people gather versus having to drive all over the place for these various services. What we did was, through the Education Reform Initiative, came out with a recommendation in 2002 on this, and then the Kent County Family and Children's Coordinating Council, through one of the subcommittees, really did, I would say, the hard work for about 3 years. All of the county department heads and school officials sat in a room and really did the great debate about how this was actually going to get accomplished. And out of it, and it really was through the effort of the Kent Intermediate School District, the other school districts, the coordinating council, the philanthropic community that you referenced, and a whole host of human service agencies. Where we are today is not only just Department of Human Services being delivered, health department, mental health, and just a bevy of services that really embrace and encompass the families in the greater Grand Rapids area.
Almost like a one-stop shopping.
Yeah, it really is.
If you will, for services for families and students. Well, that's great.
And we were really impressed several years ago. A number of us from Kent County went with a group of people connected with the governor's office to New York City to visit two programs. One was Jeffrey Canada's Harlem Children's Zone, and the other was the Children's Aid Society community schools. And what we saw in those community schools was a combination of the school is there to provide education, no question about it. But the whole other side of it was the services that were being provided, and to see what was happening within these schools was that it truly became a community center, and they were open from 6 o'clock in the morning to 10 o'clock at night. So that impressed us.
Wow. So, Don, I know you've been involved in looking at human services in this community for...
Since I was 16 years old.
I was going to say a long, long time,
Yeah.
but then I caught myself for
because you were right there with me. Yeah.
I was. I've been around for a long, long time. There's no doubt about it. But looking at ways to improve services, and Kevin, just so pleased to have you here in the community. How long have you been involved with the ISD?
Well, I've been in education in Kent County in a number of different levels for almost 30 years.
Wow.
I've been superintendent at Kent ISD for the last year and a half.
Yes.
And
okay.
it's just a great opportunity to do what I believe Kent ISD does best, which is bring these partnerships, create opportunities to collaborate, move people out of isolation, and create some good work together with partners in the community.
Well, that's great. And so, folks, we're talking about people here who have been involved in the community for a long time and really know about community collaboration. In fact, as I travel about the state, I do a little bragging on West Michigan. Actually, I do a lot of bragging on West Michigan. And talking about the kinds of collaborations that we have here, the partnerships that we have that others are hopefully starting to pick up on, and this is one great example. Speaking of partnerships, let's talk a little bit about what sorts of groups and organizations are involved. Now, I mentioned the Department of Human Services. You talked about health and mental health, others.
Well, all the county departments, Network 180, which is our mental health authority, the Health Department, as well as the Department of Human Services. Now more than ever before, because of the Coordinating Council and because of the proactive stance of our county government, those department heads talk to one another and work together. There are also the organization that was chosen to assist us with regard to what we call the resource connectors, or the community services coordinators in each school. Is run by D.A. Blodgett Children's Services, and that's been a very excellent partnership, all under the project leadership of the Kent Intermediate School District, which is perfect because ultimately we'd like to see this be broadened beyond the pilot program that we have right now. There's a whole host of other private agencies as well, Bill, including Healthier Communities, a Spectrum Health nurses that are providing services. As well as Arbor Circle. I mean, a whole host of, we've got such a tremendous coordinated child welfare system here in Kent County, though we still have our the social conditions that we all would like to resolve. But this collaboration is probably, in all of my 30 years, is probably one of the best examples of true collaboration, which in my mind is not just cooperating or coordinating, but also meshing dollars together, which has been fabulous.
And the partnership itself includes 9 elementary and middle schools between the Grand Rapids Public Schools, the Godfrey Lee Public Schools, and Comstock Park Public Schools.